State your name.
Select your ethnicity.
State your date of birth.
Ile razy jak byłeś w szpitalu dostałeś to pytanie?
Really, the forced choice of one category makes the unique culture of multi-ethnic individuals invisible. Additionally, many Middle Eastern cultures, for example, are offended by being asked their date of birth.
This first step in provider-patient communication can set the stage for positive or negative physical care and patient satisfaction. Therefore, having culturally competent nurses is important to our healthcare delivery system and our growing diverse population. 1986 was when the American Nursing Association first publicly addressed this need.
What are the ways in which we can educate our nursing students as well as our practicing nurses in cultural competence so that they can best provide the highest level of quality care their patients desire?
The patient stands to gain higher quality care across all of their health domains when provided with care from a culturally competent nurse. All patients wish to be satisfied with their care.
Student nurses will feel they have a more comprehensive view of the world and their future practice as they gain meaningful information.
Practicing nurses will feel more in control of the situations they are bounded to encounter if they are well prepared.
Even legislators are invested in increasing cultural competency, as can be seen in the state of New Jersey. Here, starting in 2008, all physicians have been required to receive cultural competence training in order to renew their license.
In addition to the stakeholders mentioned, others, such as doctors, insurers, federal government, and families will benefit because having culturally competent healthcare providers allows for increased patient compliance and adherence, decreased hospital stays, and increased likelihood of positive health behavior in the future. This all substantially reduces the cost associated with healthcare. Providing education on cultural competency positively affects the healthcare delivery system by reducing stereotyping and cultural pain within healthcare settings. Cultural pain is when an individual or group is hurt or offended by actions or words that insult or demean their culture. This occurs when the offender is unaware of cultural differences.
Wszystko z powrotem idzie do pieniędzy.
Having increased cultural competence decreases healthcare costs. A patient receiving appropriate care from the beginning will have a decreased hospital stay. This is largely supported by initiatives set forth by Healthy People 2010.
There are several impacts on nursing in general.
First, nurses who are well educated in cultural competency are more well-rounded, not only in their career, but also in everyday life.
Second, anxiety, stress, and error of miscommunication and misunderstanding are minimized in patient contact.
Third, this could help nurses better identify with their culturally diverse coworkers.
Finally, nurses who have these skills in cultural competency are more desirable candidates to their employers.
As student nurses, an education that includes cultural competency can inspire cultural desire, which is needed to obtain cultural awareness, knowledge, encounters, and skills, all of which are needed for successful practice.
In conclusion, it is imperative to include cultural competency in nursing programs starting early. Research found that the most successful method of teaching students is using the constructivist learning theory, which involves incorporating previous knowledge into their coursework.
Standalone courses in cultural competency are not found to produce desired results. Instead, using students' previous experience as well as novels written from other cultural viewpoints encourages deeper learning. By using longitudinal studies, researchers will be able to measure the level of cultural competency obtained by students taught using this method. This will help identify a future model that could be widely used in nursing education.
Today's nursing students are our future teachers, who will be at the forefront of increasing cultural competence within the healthcare system and future nurses. Remember, education is the key to cultural competency.